Instead, now, a full year later, here's where we are. More than 830,000 deaths caused by COVID, the majority of which occurred under this administration, despite having many tools and significant resources from Congress, including $80 billion plus for testing. A variant is now spreading out of control across the country, with places like Washington, D.C. seeing a staggering increase in case counts over the holidays, and now my state of North Carolina is following suit with a 319% increase as of yesterday. Over the holidays, when Americans were instructed to do the responsible thing and get tests before they see loved ones, there were no tests on the shelves or online, and hours-long lines were the norm at testing sites across the country. The testing situation was worse when many sought tests to safely return to work or to school. And the most vulnerable Americans who contracted the virus could not get the treatments designed to help because they were now in short supply. This administration has time and again squandered its opportunities and made worse in the decisions you've made on testing and treatment, and most crucially, in communications with the American people. The American people are right to be confused. It seems like you all don't talk amongst yourself. Some examples. Last August, the president announced that boosters would be available to all vaxxed by the week of September 20th. 3 of you here today signed that statement, but neither the FDA nor the CDC had yet approved boosters when the president made the promise. And when you went to your advisory panels with a predetermined outcome already made, those independent experts pushed back and ultimately had to be overridden to meet the president's goal on boosters. I know the data shows that boosters are necessary. I'm boosted. I want everybody to get vaccinated and boosted. The facts about the value of vaccines and boosters are crystal clear. But the way this administration rolled out boosters was a disaster. You created skepticism and mass confusion. Example 2, last summer the president dramatically announced that CDC recommendations changed so that vaccinated Americans didn't need to wear masks indoors, implying that the worst of the pandemic was behind us, even as the Delta variant was exploding in India. Only after Delta hit America did CDC begin to take it seriously, and the administration had to change course. Example 3. Last week, Dr. Fauci said that the CDC was going to update its guidance on quarantine. He left the American people with the impression that CDC's guidance was going to include some testing component to reduce the quarantine to 5 days. But when CDC did update its guidance, there wasn't a testing requirement. Again, I'm not questioning the science. I'm glad you refrained from testing mandates. But I'm questioning your communication strategies. It's no wonder that the American people are confused. When the president announced on December 21st that 500 million tests were going to be purchased, he left out that the contract wasn't going to be signed for weeks, and it would take even longer for those tests to materialize. Immediately, other experts and medical professionals were asking what the value of just 1.5 tests per person was when CDC's own guidance said that you need multiple at-home tests to be assured of the results. Yesterday, the administration mandated that insurers now cover the 170 million Americans that are covered by private insurance. They must cover up to 8 tests per person per month. That would be 16 billion tests. And we have 500 million today that are aspirationally going to be contracted for. It's still unclear when these tests will be available, how to get them, whether any more are on their way. But it's especially frustrating that the White House press secretary had previously mocked the very idea of doing what the president later announced. In a sarcastic and withering tone, when this was first proposed, she had 4 questions. Whether we should just send one to every American, then what happens, how much does it cost, what happens after that? Those are all good questions that remain unanswered by the administration. My final example, though there are many to choose from, happened last week too. The White House press secretary, a repeat offender in poor communications, was asked about boosters. The press secretary said, and I quote, "They can get boosted now regardless of what CDC guidance is, whether you're just approved or for a booster or you've been approved for weeks," end quote. Regardless of what CDC guidance is. From the White House podium. And then I was amazed when I got home on Sunday, and I had this letter from the Centers for Medicare and Medicaid Services telling me as a Medicare beneficiary that I'm eligible to get a free vaccine booster. 5 months after the president announced we were going to have boosters, this is the first communication from CMS that I've gotten as a Medicare beneficiary in the 2 years of COVID. And all of a sudden I get a request to get boosted.